Hey there, my name's Dr. Anthony Mendez, and my experience before this class is almost 20 years in the field of dentistry. This is actually my second career. I did public education before that and went to dental school at age 36. So I had worked as a general dentist, lots of heavy experience in dentures and oral surgery, and I think those are my areas of expertise or my forte. And I just wanted to learn something new that I could get some expertise in doing implant-supported dentures, and I hope that I can add something to my repertoire. This course was different from other courses I've taken in implants because it is very specific to getting more hands-on experience than anything else that I've had before. The classes are small, so we have more of an opportunity to see more patients and do more implants. And of course, you know, we're getting years and years of experience from all the teachers that are here, all the instructors. And that makes it a little bit different. All the other classes I've had before is one person doing all the didactic, and then maybe another person teaching the hands-on stuff and maybe getting one implant. So, you know, that's not enough experience for someone to be able to get out there and start doing implant-supported dentures. So that's why I chose this class. I think I've done 9 cases since I started the program here. Yesterday was a case where we had to extract all the upper and lower teeth, the remaining teeth. And you know, I got to use some different techniques. They use different packing materials that I was not very familiar with. I had some use of a couple of products that I hadn't even heard of as far as for closing up wounds. And that was very interesting. It was you know, that's what you want to know when you go to a different place, a different part of the country. People are using different materials, and you might not learn that where you're from. I'm from Texas, so I'd not seen those materials before. I didn't know of any of my friends that were using those materials. You know, we have similar materials, but these look top-notch, and I was very happy to get that experience. Both Dr. Brown, Dr. Chapman did cover a lot of topics. One of them was how easy it is to redirect an implant that might not heal well, and how to be able to redirect the position of an implant so easily without having to worry about whether that area where you had previously been is going to heal up well or not. And kind of they lowered the concern, the level of anxiety, I guess, that you might have when you're doing a case and you have to reposition, you have to move the implant from one site slightly over in either direction just to get better healing. So I was real glad to learn that integration happens very easily from what I've actually been taught. I would say my confidence level has improved. I would probably attempt some easy implants before I really get my confidence level to where it needs to be. I think that everything that you're taught here kind of builds up to having a higher knowledge and having more experience to feel more comfortable doing implants. And I would say that definitely happened in this class. But I'm not going to jump right in and say, oh, I'm going to do a whole full, you know, 4-on-4 and say I'm an expert or anything. Everyone can learn more. Dentistry is a learning process all through your dental career. Every year something new comes out, new technology, new materials, and I think that anyone that says, you know, I'm totally comfortable, that they could be more comfortable. If they're really, really telling the truth, they're able to do as much as they can at that point, but you can always learn more. The atmosphere here at the Institute is very laid back, and that's good. I was concerned it was going to be very aggressive and very intimidating, and it wasn't. It was, there's a lot of music and camaraderie, so that's good. And I think all of the professors have been very helpful to bring our expectations up and maybe our anxiety down quite a bit. So I'm very happy with that. Would I recommend this course to my colleagues? Only if I know they would take it very seriously, because there's a cost factor here, and there's also a responsibility to do really good work. So yes, this is a class to take if they're serious that they want to be better implantologists. One class builds on another class, and probably keep taking other classes as they come up, because it just like the cases we've gotten, start with some basic cases, and now we're learning some more about implants and can do some more advanced cases. So yes, you definitely would recommend it.